few more minutes for the team to join. And once we reach the threshold of 500, then we can start the engagement in the next 2 minutes, if that's okay with you. So give us 1 or 2 minutes for us to ensure that all the other members have registered or have joined this call, and then we start in the next 2 minutes. Thank you.
Alois, I think I've seen feedback from like 3 people,
Yeah.
3 chairs. They're saying they have trouble joining. One is talking about the password and stuff like that. I don't know.
Egan, do you have a password? We don't have a password for this one. And you can see the others are joining.
Once they've registered, they just click on the link that they will receive. Huh?
Okay.
Yeah. So I think we are right on time. Good afternoon, good evening, colleagues. I can see we already have over 200 members, so we can start this engagement. I would want us to all stand still and as we get our national anthem. So, Egan.
O God of all creation, let one and all arise. Let all with one accord
Thank you to the communications team. So good morning, colleagues. Good afternoon, colleagues. Good evening, colleagues, wherever you are in this world. We are going global. Don't worry why I'm talking about good morning. So welcome to this webinar, the webinar on Electronic Community Health Information System. The purpose of this webinar is to capacity build our community health assistants, our community health officers, our healthcare workers, and everybody else who works in this community health space now to use this platform which the government has deployed countrywide for not only supporting service delivery, performance management, and also as capacity building tool for community health workers, but also as a tool that we are all at a national level able to access the data and look at the population health outcomes at different levels. We are joined by a number of key personnel from Ministry of Health and CHESOA, as well as stakeholders such as AMREF and MEDIC. And we are here, all of us, to work together with you as the people working with the community of promoters in different places to be able to use this system for decision making. I don't want to take a lot of time because we have 2 hours of learning, 2 hours of engagement. And in the meantime, just to ensure that we feel that we are welcomed by the National Government of Kenya, I would want to welcome Dr. Maureen Kimani, our National Community Health Systems Director, to give opening remarks, and also welcome the team to this webinar. Thank you, and over to you, Dr. Maureen.
Thank you so much, Alois, for the introduction. I think I'll just put my video shortly so that people can be able to see me. But very excited that this is happening. This has been a dream come true for us at the ministry, that we are able to digitize our community health services. We all know that we had this strategy from 2022, and we are very happy with the help from national government, from our partners, and even from the county government and all our community health focal persons, both at county, sub-county level, and the CHAs and the CHUs, who have been instrumental in the rapid rollout of this electronic community health information system. We have seen a very rapid deployment that has happened to all the 47 counties. We have over 100,000 CHPs using ECHIS, but we know with the rapid deployment, there comes lots of challenges around building the capacity of all the players within this space to be able to fully utilize this data that we are collecting, but not only that, to be able to be fully familiar with the system that we are using. We know at national level, on a daily basis, we are working on enhancing the system to make it more user-friendly. We know there have been a number of times when the system has been down, and there are quite a number of hitches here and there. But we are really looking forward to have a seamless system. So this is work in progress, that every day we're improving, and we are looking forward to all of you guys. This meeting is particularly for our supervisors of CHPs, to be able to understand the system fully, and therefore be able to support the CHPs to be able to use the system to deliver standardized community health services across the country. We want the person in Mandera, the person in Lamu to get the same standard of service, because the workflows are similar across board. And we want to make it as easy as possible to be able to utilize this system to improve our communities, the health of our communities, and of course ensure that we are contributing to universal health coverage within the community health space. We have not done this alone. We have had lots of partners working with the Division of Community Health to make this a reality. So I want to thank all the partners, particularly our tech partner, Medic, who have been very instrumental in supporting us, but also to thank all the other partners who actually bowed out and said we will not implement parallel systems, such as AMREF, the Mjali, and many other partners, the ComCare by Loala, so that they could all join hands to ensure that we succeed in this digitization journey. So very glad to be here. I want to welcome all of you. I understand we are over 2,000 participants registered to attend the webinar. So we are very happy. And for the people who have not joined, please ask them to join so that we can all be able to move together. Thank you very much. And I now give it back to the chair to continue with the rest of the program. Asanteni. Bye.
Thank you, Dr. Maureen. And we could not have done anything in community health without you and the Ministry of Health support. First of all, in providing the phones to all of us, giving us a system that is standardized for every single county, and even looking for solutions where we are struggling when it comes to the community health services in the country. So without much further ado, I want to welcome my own brother, Wycliffe, I've worked with him throughout everything that we've been doing as a team to support community health services and also supporting the CHESOA and supporting community health workers and community health promoters, community health assistants and officers in not only career progression, but also CPD curriculum to registration and everything. And this man really has been the defender of this cadre. So over to you, Wycliffe, to give your opening remarks, and then I'll hand it over to the moderator for the day. Wycliffe?
Thank you so much, Alois, and thank you so much, Dr. Maureen. I think my name is Wycliffe Ogenya, and I am the National Secretary General for CHESOA. CHESOA, for those who might not know, is Community Health Services and Development Officers Association. I want to start by saying that we really want to appreciate the support from the Ministry of Health, AMREF, Medic Mobile, and other partners for making this possible. I also want to sincerely thank the participants for being able to join this webinar. As an organization and as an association, one of our key objectives is to advance knowledge regarding community health practice. And I know that the World Health Organization basically recommends incentive, supervision, and training if community health worker programs were to be successful. So in the spirit of capacity building, we felt that it would be good for our officers to be well grounded in as far as community health is concerned, particularly electronic community health information system. I want to also say that because we are working on the space of CPD and to be able to regulate community health, this particular webinar will be CPD accredited. That is continuing professional development. So points will be earned for those who are going to participate. So I welcome all of us and also our members to be able to sit through this webinar and to be able to ask relevant questions. Thank you, and over.
So much, Wycliffe. Just a few rules of the road is that this is the first of the 4 weekly webinars that we are planning with the Ministry of Health to ensure that we're able to capacity build the supervisors of community health promoters on ICHIs. And this will be the introductory bit, of which then will be followed by 3 or 4 more webinars to go deeper in some of the areas to be supposed to be tackled under ECHIS. The second thing that I would want to request is, please, for the members who have already joined, text your friend, text your fellow community health assistant, text your fellow community health extension worker, and let them join, because as you can see, we are already at 400 members as at now, and we expected at least 1,000, and the others will be supposed to join us to stream live, because you have the live stream that is also taking place at the same time. And the final piece is just to appreciate Wycliffe for the good work that he has done in coordinating this. We could not have done this webinar without Wycliffe, without the team at CHESOA, without the team at national government and the team at the counties who have been coordinating these activities. So Wycliffe, thank you so much for your remarks and thank you for this. These are the expectations that we received from you when you are registering. But on the chat, in case you have a question, around ICHIS or around the area that any of the members will be addressing today, feel free to ask that question and the team will be able to work on that and give you the feedback. Again, some of these questions may not be answered today, will be answered either in subsequent webinars that we, like I said, we'll be having 4 more or 3 more webinars, or we'll also develop a Q&A that will be hosted on the CHU for UHC platform that this whole team also supports. So thank you so much. Thank you for all of us who have participated. We have reached over 400 by now. And I want to hand it over now to the moderator for the day, my brother, Titus Kiptai. Titus, the M&E officer at AMREF Health Africa, and he has also been one of the key persons when developing and deploying ICHIS in the country. So over to you, moderator for the day. Asanteni, and let's have a great meeting.
Thank you very much, Alois, and I would like to extend my appreciation to Dr. Maureen Mani and Weekly from GESOA for the good introductory information. At the same time, Alois for the opening remarks and also opening this session for us. Team, welcome to this webinar. It is one of its own, as it's the first one to be held for community health services as far as EG is concerned. We have diverse participants from organizations, from national government, county governments. We have also from institutions, universities. We have quite a number of diverse community members. Thank you very much for joining this session. In our next steps, we'll be looking at how best are we going to address some of the expectations from the participants, as Alois has just alluded. But allow me to mention a view from the registration. We got expectations and we tried to analyze majority of these expectations. And the thing which we are seeing here is majority of us wants to learn more in ECHIS, how we can understand how we can do supervision with ECHIS, at the same time, delivery of services using ECHIS, and the reporting and also use of data within the ECHIS system. So these are some of the areas which we will be discussing throughout our 2-hour session. And as it now, we have 3 key facilitators who will be taking us through the different sessions. We have Tabitha Waweru, who will be giving us the overview, and Tabitha is one of the experienced and key member as far as ECHIS and community health is concerned. As Assistant Director for Community Health Services within the country. She will be taking us through the overview of ECHIS and the different workflows which we have in ECHIS. And our next facilitator will be Mr. John Seda, who is the Program Manager for Community Services at Muhoroni. He will be giving us an experience as Program Manager implementing community activities within the county and showing us the different areas of ECHIS and how we implement community services using the ECHIS. And then we will have our ICT expert, Mr. Philip Ngare, who will be taking us through the different aspects of user management and how to troubleshoot different challenges within ECHIS. So allow me to welcome Ms. Tabitha Waweru on stage.
Thank you very much, Titus, and thank you, everyone. Allow me to disconnect my video as I am not in a very good network area, but I want to confirm that I am audible.
Yes, you are audible, Tabitha.
Thank you. Yeah, good evening, everyone, and I hope that you are having a good day. My name is Tabitha Waweru, as Titus has rightly put it. I work in the Ministry of Health, Division of Community Health, and I do MND, and I'm happy to share electronic community health information system to all our community health assistants, community health managers, and all the people that work at the community health space. So I know we have been hearing about electronic community health information system, and Dr. Maureen has told us generally where we are in the country, what does the future look like in terms of the roadmap, and where we are headed. Allow me to go straight to the system itself. But just to mention, this is a tool, a mobile application that enables the management of community health services. So we all know that traditionally we have been doing our business at the community level using manual, the service delivery, and even the reporting part. But currently, due to the challenges that comes with the manual, we have been digitizing community health services through now the system that we are calling ECHIS. Others call it ICHIS, Electronic Community Health Information System, but this is just one thing, mobile application that helps us to be able to carry out our activities at the community level so that we can improve the health outcomes of our community, and also the reporting, the performance management, and other things. Just to mention that before we settled on the ECHIS, there was an assessment that was done across the country to see what digital solutions exist. And we realized that there were some forms of digital solution that existed. And it's out of those many different forms, there were 28, that we chose one that was meeting both the functional and the non-functional requirement of digital system at the community health level. And now that there was one that was close to that, and that was what was used to enhance this system, and then get the community health information system that we have now. This was piloted initially in Kisumu County, and then we did an evaluation whereby we gathered user feedback and used it to enhance now the version 2 that we have, that was now, if I can say, tested in Migori County, and now rolled out to the 47 county. So each
Tabitha?
CHS is a, yes?
I don't know whether you are sharing anything on your screen, because we can't see.
No, I was not sharing anything,
Okay,
but now I
okay.
want to, yes, I want to share my screen now, because I want to go to the system. I was just giving an overview. Yeah, so having said that, ECHIS, it's not only a reporting tool, but a service delivery tool, because it has decision support. You offer the services in there, and then transmission of the reports, performance management, user management in the whole ecosystem. Yeah, now having said that, I want to start projecting my screen so that we can go to the ECHIS. I didn't want to use the slides. I wanted us to go into the system. Let me know whether my screen is visible.
Yes, it is.
Yes. So when we are saying ECHIS, and we've said this is a mobile application, this mobile application is an open source that was published in the Google Play Store. If you want to, of course, I want to begin by saying ECHIS has different hierarchies, and not everyone can be able to use ECHIS, because we are alive to the Data Protection Act, and we are also in line with the community health structures that we have the CHP at the ground level. Then we have our CHAS being the supervisors, we have the sub-county managers, county managers, and up to the national. So that means we will have these levels even in the ECHIS. So when you go to the Google Play Store, I want to go to my Google Play Store here. You just type CHIS. If you type CHIS, you will have two types of the ECHIS application. Let me see how to hide this. Yes, two types of ECHIS application. Like, where did this go? Like what I am projecting. What we are seeing. Okay, what I am projecting, you see, I am in the Google Play Store. If you go to your Google Play Store, just type CHIS, and then it's going to bring you like what you're seeing here. So first, we have this production, which you see it's written CHIS Kenya 2.0. So if you are not in this, just know you are somewhere else, because we noted that there are some CHPs that were using the training instance. If you go down, you will see another one, but clearly written the training instance. So it's always important to look at the instance that you're using. Are you using the right instance? Is it training or is it the production? The production, remember, when we were going to our browser, we input our county specific instance that has the specific URL. And then after that, what you're going to see is the CHIS Kenya 2.0. That is the current version that we are using. The other one is rightly put as the training module, the training instance. So I want to share. Then another thing, in order for you to get in, you need to have a username and a password. And this, we ask the county management team to forward the details of each level, the details of a CHU, the CHPs in a CHU, their CHA, the sub-county focal person, and the county. Because we all know that the services are from the CHP to the CHA, sub-county to county. So upon giving us the names, the phone numbers, credentials are issued to the CHPs, to the CHA, and all the community health managers to be able to gain access to the ECHIS. Once they gain access, once they have the credentials, I want to project and assume now we have come here. Let me go back to what we will have. When we go to the Google Play Store and download our ECHIS, you come to your browser, or if it's the phone that you are using, you go to the Google Play Store, you download. After downloading, the landing page will be like, let's see, choice. That one. Not here. Yes, this one. So for me, it's coming in because I have, I want us to, okay. Okay, perfect. Yes. So this will be the landing page, but of course you will not be having the username and the credentials like it is here. You can see mine, I have already populated for in order for us to save on time, but you will input your username here, the one that will be given by, currently the county management team have been capacity built to be able to create credentials for all the people. But initially we were doing that from the national level, but currently we have decentralized. So even the county CHRIO and the ICT officers are able to create credentials for CHP, the CHA, and all other community health workforce. So you put your username, you put your password, and then you log in. When you log in, just to log in and see. The login, there it is. This is the page that you're going to see. Mine, I'm using an account that has been used for training. So ignore the details. But the things I want to focus on is these 5 icons that are here. Allow me to start with the people icon because this is the most used icon. And before starting, I want to tell you that this is a CHP. I have decided to first of all log in as a CHP so that we start from the primary level coming upward. So I have logged in as a CHP, and then after we finish with the CHP, I will log in as a CHA and see what a community health assistant does. I am not sure where we will have time to go to the sub-county, but I'm gonna mention that before I finish. So kindly note that this is a CHP that has logged in. So the people icon is the first, is the most used icon. And in here, it's where we do most of the services, Like if we can go back to the business in community health, the first thing after establishing a community health unit is the mapping and registration of the households. So this is where the CHP is going to, because when they download, the system does not have anything else. This is where they will start by registering their households and even offering services to those persons in the households. And we will come back to seeing how do they register, how do they offer services. Allow me to go to the next icon, which will be allow me to jump the reports and go to the tasks. The tasks also is a very important icon, because this is where the CHP gets their daily activities, or we would say this is like the daily register. This is the icon that they are supposed to be looking on a daily basis to see what tasks they should prioritize, and to see the reminders that they are being told to do. And then we have the reports. This is where we look at the reports that have been submitted by that particular CHP. Then we have the performance. The performance is an in-app dashboard for the CHP, which is very lean, just to accommodate few indicators for the CHPs to be able to gauge themselves, or even to look at the work that they have been doing and trigger an action, or even raise an alarm. Because if I can look at one, they will see, if I'm looking at this, you see this CHP has 766 households, but they have they have not registered any. So they will be looking at this and seeing 0%, and this, of course, it will trigger action. That is the part of performance, which is an in-app dashboard for the CHPs to be able to monitor themselves. Lastly, we have the messages icon. This messages icon, we have two types. We have the one that the CHP can be able to communicate to the CHA, and the CHA can be able to communicate to the CHP using the SMS. For example, a CHP can just text their CHA, and the CHA, and the vice versa, CHA texting their CHP. So that is already complete. The other function of the messages was to enable the CHPs be able to contact their household members and do targeted messaging. Like, for example, it's a mother that is due for the ANCs. They can be able to do a text message and remind them, kindly, your ANC is scheduled in the next 2 days, kindly prepare to go to the health facility. That is very targeted because it is for that particular client. And then 2, non-targeted messages, whereby we can be able to pass health promotion messages to the household members using that icon, using the messages function. Unfortunately, the part for communicating with the household member is not finished, as there are still some other logistics that should be put in place before we say we have finalized, but the communication from the CHA to the CHP has been completed. Allow me to go to this icon, this one here, we call it hamburger. And what I want to highlight on this hamburger is that this is where we can log out, but currently for the CHP, we do not have the logout. We can be able to see the instance that we are in if we come to the about, and most importantly, we can be able to see our syncing status. I will talk more on what is syncing after we have finished with what is in the CHP app. So having talked about the 5 icons, starting with this important, how I like doing this to my CHPs in order for them not to cram. I usually tell them that we have 3 areas of operation. If you do not know anything else, just master that we have 3 areas of operation. Number 1, the CHP area. Like here, you can see the CHP area. But when we have put our name, like here, we are saying CHP1 area. So if I had put my credentials, it would be reading Tabitha Waweru area. So in that area, your area, what can you do? So you click your area, and then the next important thing is the plus button. Some call it plus button, others the action button. floating button, the blue button. So whatever you call it, the action button, and then there you will have all the services that you can be able to do at your area. You don't need to cram, you just need to know. The CHP just needs to know that we have 3 areas of operation. The CHP area, and that is one, and then you click the plus button, and then you will have all the things that you can be able to do at that level. And now you read, do I want to register new households? Do I want to submit a SEB signal? I will be coming back to that. Do you want to count your commodities, or do you want to return your commodity? That is one area. Number 2 area that they need to know is the household level. Like, for example, now in the CU, in my areas of the 100 households, or whichever households that I have, what can I do? That is what we have covered. The next one is that the household area. Like, for example, you go to this household, you don't click inside, you just click the household itself, and you come to your floating button, click it, and look at what is giving you. You can do household air, you can add new person, you can do household air pollution, household flood status, you can mute this household, you can do economic survey, you can be able to do all these services. It will be showing you the services. You do not have to cram. But of course, I usually tell the CHPs that you should already know what you want to do before you come to the system. The system has not replaced the knowledge. It is just enabling what has been existing. So they should always be knowing what they want to do before they come to the system. Because if they are coming to the system to fumble, they will have a lot of difficulties. So you can be able to do all those services at the household level. That is the second level. The third level is at the individual, because we can offer services at the area, the whole area, at the household, just when you get to the household, and then individual. So in the individual, just the same way you go to a household, you gain entry, and now you get to the household and have a particular person. You come in now here, and then look for the person that you are talking to, the person that you want to give service. For example, I want to give service to this Damaris Anyango Odoyo. These are just hypothetical names. When now you are inside that individual person, you click the plus button, and it will bring you the services that you can be able to give this person, depending on the age and the sex of this person. Allow me to repeat the 3 levels that I have said. Number 1 level, when it comes to the ECHIS at the CHP level, is the CHP area, my 100 household, all of them wholesome. What can I do? Number 2, household level. What can I do at that level? Number 3, personal level or individual level. Like I want to give individual services. So let's go one by one, seeing what we mean by all this. So we're going to start with this first level, which is the CHP1, the CHP level. And when I go to the CHP level, I want to come to the plus button. That is what we said. And then I can be able to register a new household. It is self-explanatory. If you go to that form, I don't want to open all these forms, you will be able to see how to register household. And I want to believe that SEDA will be giving us now the nitty-gritties of implementation, what it takes for us to have a successful household registration. How are you supposed to prepare? How is the CHP supposed to prepare the household head in order for us to have a successful household registration? So SEBS signal reports, we know that we usually have community-based surveillance, which now community-based surveillance, we have 2 types of surveillance. We have one, community-based disease surveillance, whereby this is disease-specific, whereby we use the lay case definition at the community level and the standard case definition at the health facility level. So that is disease-specific, whereby we are looking at the measles, AFP, and all these diseases. And then what is here is community event-based surveillance. Now, that is where we use signals. And these signals are just broad statement that will lead us to a condition or to an event that now upon investigation will tell us what type of a condition we are dealing with. Allow me to mention that the Division of Disease Surveillance and Response has rolled out the community event-based surveillance in only 6 countries in 7 counties in country. And so we have a lot of counties that this training have not been done and the SEBS has not been rolled out. That's why sometimes we are having a confusion of the events at the community level and the SEBS signal reporting. So for those that are doing the SEBS, that is community event-based surveillance, these are people like Siaya, Busia, Nakuru. They understand how to report with the mDharura application. This is an application that we are looking forward to having is integrated into the ECHI so that when you report the signals, the community health assistant is able to verify, is able to triage, and then the sub-county can be able to do the risk assessment and response and all these other things. So for the 7 counties, I usually encourage them to continue using the mDharura. And then these other one, they can report, but now we need to tell the CHPs what are these signal reports and how to report them. Then at that level, we can be able to count our commodities. And the commodity counting, we usually count the last day of the month because that is what will help the CHA know how many commodities to quantify to be able to order. And then commodity return, this is where if a commodity is expired or they want to I hope I am still with you.
Yes, Tabitha.
Oh.
Wrap up.
I saw
Yeah.
Tata calling me and I thought I am on my own. Okay. Let me wrap up. The commodity return. Then we have the household level. At the household level, if you go to your plus button, you will see all these things. You can be able to add new persons. We understand what that is. Household air pollution, household flood status. You can be able to mute household. Allow me to go into details just a second into muting. Muting, I have seen in many forums, people muting households, muting people because they have died. This is a feature that I have seen CHPs confusing. If a person die, they submit a death report, and because the community health assistant has not approved that death, the CHP still sees that household active, and now they come again and mute that household. Kindly, if it's a death report, we should only report it as a death report. The CHA should approve so that that household is muted, so that we do not have community health promoters now coming in to mute those households. And then we will have the individual level, and this I know Seda will be speaking more to them. We will have all these services that we do at the community level based on the age and the gender. After the CHP has completed their work, let's say they have completed, they will have now the tasks based on the work they are doing. Like if you look at my task section, we can see we have registration reminders. This CHP was doing registration, but there were things that he was not capturing. This is where we say that we will have the duties of the CHPs being populated. Finally, they have done their work. We encourage them to do syncing or synchronizing. Because when you finish and submit, that is equals to save. That has only been saved into your device. It has not been transmitted to the next level. Meaning, if the CHP loses that, all that information will be lost. But if they were syncing, we can be able to retrieve that information and bring it back to their gadget. So syncing is very important. We did a data quality audit and we found CHPs who synced 8 months ago. And now we wondered, how does that report look like? I want to pause there for the CHP and log in as a CHA, but the details are close, almost the same. I want to see whether I have a CHA here. I have a CHA here and logging as a CHA. The same, the 5 icons remains. The syncing button is for everyone. And then the same for the CHA. You have also 3 levels. Number 1 level is the whole CU. What can you do for your whole CU in general? Before going to there's an update. Before going to the individual CHPs, what can you do at the CU level? If you log in as a CHA, you will have all your CHPs listed on my left side, and all your CHPs listed. For me, you are seeing one because I only have one CHP. But now here you can see, this is my CU. Sorry. Allow me to remove this thing. Cancel. It's been giving me a lot of... Ish. Let me cancel this.
Yes, you cancel, Tabitha.
Okay.
I would like to request the participants to continue. If they have some questions, kindly raise your questions in Q&A section. I'm following that.
Okay. So your number one level is your CU, the entire CU. The same way you come, you click on the entire CU, you click on the plus button and see the services that you can be able to do. For the SEBs, I won't dwell so much, but we know that even a CHA can be able to report a signal. Then you can order your commodities. Remember the normal commodity orders. CHA orders the commodity at the Link Health Facility. And then we have our community event. Allow me to click on this because this forms a major part of the work that we do. So in this event, as we were doing the data quality audit, I came across many CHAs that did not know where to record their dialogue days, their action days, and so they had not recorded for the last like 5 months. So here you can be able to report your dialogue day, action day, and the monthly meeting, and any other event at the community level. Then we go back to the CHU level, and that's it. Now, your other work, the other important work of a CHA is support supervision. So now I am to my specific CHP, and so I am gonna click my specific CHP and come to my blue button. And one thing you can do is schedule calendar for supervision. You have each dates for your CHP to be able to supervise them. So you will come here and schedule CHP number 1. I will supervise you on this day. And this notification goes to the CHP, so they are aware and they have prepared to receive you that date to do support supervision. I am sorry to say that out of the 8 counties that we went to do the data quality audit, only 2 counties, and that is 1 CU per county, like 2 CUs had done the supervision calendar or any form of supervision. So this is an area that we really need to put more effort in. So you can be able to schedule, or you can be able to do as you encounter the CHP, because you could be going through the area and then you encounter a CHP and you decide to do support supervision. So that is provided here. You just click here and you go to the to do the support supervision, mentorship, and your coaching. Then the last one would be commodity supply. Commodity supply, this is where now, after getting the commodities from the Link Health Facility, you supply to individual CHP. And after supplying, a CHP will get a task to be able to receive their commodities. Kindly, I saw people, I saw a CU where CHP was supplied with commodities. The CHA, the community health assistant did not know that they are supposed to go to the task and receive. So what they were doing, they were counting down the commodities and writing what they have been supplied. Remember, that will not help in the management of the commodities, because as we are dispensing, the commodities are being subtracted, and we can be able to monitor our stocks and even raise an alarm when we have stockouts. So it's important for us to know that after we have supplied, we will be needed to go back and receive our commodities in the tasks area. Finally, remember also for our community health assistant, we have the syncing button. This is now what will be used to transmit that information to the next level. I think that's all for the CHA, but let me talk about the performance. For the CHAs, we have the in-app dashboard still, that you are able to look at how the CU is faring on through this in-app dashboard. But we also have a comprehensive dashboard that is called Superset dashboard, whereby we have different forms of dashboard. that you can be able to get in and interact with the dashboards for more detailed. When you're given the credentials, we have all these dashboards, but of interest would be the supervisor dashboard. This is where you as a chair, the supervisor dashboard and the CHP monthly performance dashboard, these two dashboards, where this should be your most frequent visited area, these two. This is where now you will be able to look at all these parameters when you come to the CHU level. You're seeing this figure because I have not put any filter, and I am using the national level. So when you filter, we have filter on this side, you filter down to your CHU, you'll be able to look at your population, you'll be able to look at maternal health, child health, you will be able to visualize your MOH 515 reporting, and you can be able to see your WASH indicators and for performance management. And the last one being the CHP monthly performance, you'll be able to see the individual CHP, how they are performing. This one you are seeing, it's the national level. You can be able to see the CHPs that are doing well for the last month. So for you, you will be seeing your 10 CHPs in one CU, or the number of the CHPs that you have. Those are the two main dashboards. I don't think we have time to go into these dashboards in details, but this can be the next form of now sensitization that we want to do. The last thing I want to mention is, after doing all this, we know that we usually report aggregate data each and every month to the KHIS. So what happens is that our report is usually aggregated in our summary, which is the MOH 515. And this is brought for us as chairs in the tasks that you have received a task to be able to approve, validate the MOH 515. Then you submit, and the sub-county is able again now to push this to the KHIS automatically. We know we have been having issues with the automatic transmission of the 515 from the ECHIS to the KHIS, but currently I want to believe that now that is seamless. It's working in all the counties. Yeah, I
Thank
think
you very much.
that is, yeah, I think that is my time. Thank you very much, and over.
Thank you very much, Tabitha, for the good presentation. I know it's the first session and the system is a bit unique and big in terms of the different number of workflows which you are supposed to touch through at least a good number of them. So team, as I welcome, John said will be taking us now in details, just for 20 minutes, the different areas. He will only focus on few areas. He will not be able to manage all the areas, but I just wanted Tabitha to explain a question here, which is very important, and Zeda is coming in about synchronization. And one of the members is asking, when are we doing that and where? Let me read. When is done, where and when, and must you have data bundled, and then what happens? So that one question, consolidating the others, so that once we finalize, we'll be able to answer.
Okay, all right. So synchronizing equals data transmission. I said when you submit, that equals to saving. Like just the way you do your work in your laptop and then you save. But that doesn't mean that you've sent the person that you was intended to. So synchronizing equals to sending now that information, if you're a CHP, to your supervisor, who is the chair. If you're chair, now you're sending that information to your supervisors and also to the server. So for the synchronizing, you can see this where my cursor is. We call it hamburger menu. So here, this is where we have now synchronizing. Sync now. You can see my last syncing status was 454, and now we are in 457. When you are in a network, when you are already having internet, the synchronization is usually automatic. And the the part, okay, I've answered where. It's the synchronization button in the hamburger menu, what we are looking at. Then when, this should be regularly. This should be regularly, and regularly, I mean, if I have offered a service, I should sync. I should synchronize. When I offer a service, I synchronize. So that now that information so that I can say now I have worked, I have done this and saved that to the server. Then am I required to get the bundles? The answer is no. The URL has been whitelisted, and we were saying that those CHPs that are having troubles with synchronizing when they do not have bundles, we should forward their details so that we can look with Safaricom and see why the whitelisting is not working. So I encourage that we look at our CHPs that are having difficulties or that need to buy the bundles in order for them to synchronize, forward the details so that we can have it checked by the Safaricom. Thank you.
Thank you very much, Tabitha. Let's welcome John Seda to take us through the different areas now in detail. And I'm requesting Tabitha, you just go through the question and answer session. Kindly try to respond in some of the questions by typing the answer. And the team members who are actually giving us or asking these questions, you can as well interact with the answers within the chat section for Q&A. Thank you, Seda. You can stop sharing.
Thank you, Titus. Just confirm that you're able to hear me.
Yes.
Thank you. And I'm switching off my video to allow the audio and the presentation to be more clear. Before I do that, I hope Tabi will be able to pull on the presentation so that I can put up the other one. The other one thing I want to say, I'm John Seda for the people meeting me for the first time. I Kisumu County, and to take it off from where
Tabitha,
left.
kindly stop sharing. Oh.
Yes. I'll say that I want to take it from where Tabitha left. And I want to say this at the beginning, that this digital tool is one of the most powerful tools in for the success of community health services. And I think it is one of the silver bullets which will take Kenya to the next level. And without even going to the CHA app, there are several tools which come with this HS tool. And we have the CHA app. Let me use that. And we also have the one for the CHP. And I want to dwell most on the CHP app, which is where the rubber meets the road. That is where the services are being done. And I will be taking my colleagues on a number of things. One, I will start with the most important workflow, which Tabitha talked about. And that workflow is how to register household members. We will not go to the workflow one by one, but to take us through how to prepare the grant and how to make sure that this activity is actually done. So we believe that every area, and the area, depending on which pocket you are in, you will be looking at between 50 to 100, up to 100, even more. And the need to prepare a household, an area before this exercise is to make sure that we actually reach 100% listing of the households. Meaning, the CHP area is having 200 listing, we need 200. So where big the baseline? Because baseline is the first thing. After training, every CHP is mapped for an area, or previously the area they used to work in. Then we will ask how many people, probably how many people, this can be sources, but when you have existing CHPs, that data will be with the CHPs. So if a CHP is having 150 or 100, that will form more baseline.
Seda, I think your network is not very stable. Kindly check.
Okay. Can you hear me now?
Better. But
Okay.
it keeps on breaking. The voice keeps on breaking. You can.
Okay. If you're able to hear me now, then I can continue.
Yes, that is better. Continue.
That is better.
Yeah.
Yes. I want to say this, that the first thing we need to do is to make sure that we have mapped all the areas we're supposed to register houses. Meaning every CHP will have a baseline, and the baseline is different from place to place. There are places where baseline would be 100 or 50. This baseline will be the test whether the CHP has registered all houses or not. And at the end of it all, there are a few things we need and we expect. We expect that all houses are registered. Secondly, all members of the households are registered. So I want to take us through how we'll know. And Tabitha had talked about some few tabs. And one of the tabs she talked about was performance. So as an officer or a supervisor supervising CHPs, you'll have to go to the performance tab for each and every CHP. And let me say this, that the CHP app is not only for the CHP, but the CHP app is also for performance monitoring and supervision by chair. So anytime we have a contact with the CHP, it is good. It's a good practice that we pick the form and go through what they've been doing. So when you come to the tab, performance tab, you will see the total number of households. You're able to see my cursor at the total number of households. And in this place, you'll be able to see the number of households registered by that CHP. So against the target, you'll be able to know whether the CHP has attained 100. That is one. Secondly, you will be able to sample during that exercise. And I want to urge all of us that registration process is such an important process that we need to allocate time for it. For example, if after training, we can allocate 2 weeks, and a good practice will be between 2 weeks and 1 month, so that we have a clean data upon which we'll start service delivery. And I'm not saying that we are going to stop totally the service delivery, but we are saying that for emergency cases and other cases which need our attention during that time, we'll be able to refer. But our focus during the 2 to 1 month will be to develop a profile for the CU and for the village. So during that time, what will be the officer, the supervisor doing? The supervisor will be going supporting the CHPs, one with the app and the troubleshooting, which my colleague will come and talk about. And the other thing will be to look at the performance. What is the progress? And the first progress, when you meet a CHP in a household, will be to pick a household at random. And this will happen at the household level. So you meet CHPX at a household level, you pick a random household, you go to, for example, I want to go to this first household, Peter Seda. And the first thing is to confirm, are all the members of that household listed? So you will go and the app provides the list per household. So for example, in this household, we have Mary Wanjiru, Mary Njuguna, and Peter Mwangi. Those are the 3 household members who are there. So we'll compare it against the total number of household members which have been reported at that time. So that will go on and on and on until we are satisfied that all our households and people within those households have been listed. There's been a lot of issues where a CHP registers only one member of the household head, and then it's done. Remember, with this tool, after this exercise, the CHP will not be able to offer services to people who are not within the household, within the HS. So for us to make sure that we offer services to all of the people within our area, we have to make sure that every member of the household is actually listed. The other thing is that, as opposed to the old system where we're doing we are updating after every 6 months, digital system gives us an advantage that the ages keep on changing. For example, if I'm 1 day today, tomorrow I will be 2 days. So I will not be able, the CHP would not need to go back and change ages. So the people whom you started with, their ages will keep on appreciating until that time when they either leave or something else. So we don't need to go back and list them again. Yes, there is the other thing again, that what about people who are not there at the time when we were listing household members? Two things. People who have come in either as a household or mostly in towns and cities like Nairobi. CHP will have to, every time you meet a new household member or a new household coming in, we'll be able to add them, meaning this will be a live workflow, a live document. If there is a member of household, and Tabitha mentioned it, we'll be able to mute them. And if there's a household member who was passed on, we'll be able to send a death report so that we remove them from the system. Remember, muting is not removing or deleting a household member. Muting, for example, I can tell you mute in my class. It means that I'm able to see you, but there are no actions from your end. So when they come back, for example, a household member moves to Nairobi from Kiambu or from then after 6 months, they come back and they would want to stay. So this household member will be unmuted again to continue with the living, with the rest of the household members. I want to repeat again that this is the most important, one of the most important workflows, because upon this, all other services are layered. Without a good list for the household, we are unable to develop a good profile for the village and a good profile for TU. We are unable to develop a good profile for the village and a just anybody confirm if you're able to hear me.
Titus, please mute. Thank you so much. Please proceed. You can hear you, Seda. Thank you.
Thank you. So I want just to mention that at the end of this exercise, what do we expect? We expect that we have the total number of households, that is 1. We have the total number of people in a village. Cohort-wise, we have total number of pregnant mothers under 1, meaning we have a full profile for the village and for the CU. This data is not only important to higher levels, but this data is so much important to the community level, the village level. For example, there's a planned campaign for polio, and people will be putting targets 150 for this village. Now we have a real-time data where every village, as each we can say, I have 20 under 5s, and we can measure our performance based on that. So the use of this form goes beyond just the service delivery within HEs. After this is done, the CHP now goes to the services, and this is where I want to head to. And in services, I want to say there are 2 words which are very common here. The first word is action, and the next word is tasks. And the taskbar is one of the tasks which was shown here by Tabitha. If you can see my cursor. So that is the taskbar. And then we have the action. I want to explain the difference within those 2 words. Action are the initial steps taken by a CHP to offer services, or the initial services offered by the CHP. For example, if I'm meeting a mother for the first time to map them because they're pregnant, that is an action. For example, if I'm going to a household for the first time, they don't have a toilet, and I talk to them about wash, that is an action, meaning this action has been initiated by the CHP for the first time. But the tasks are the system generated reminders that have been automated within HS based on the actions of a CHP. And I want to say this because I've met a lot of CHPs who celebrate that we don't have any task. So it means, therefore, that for the tasks to be there, CHPs must perform certain actions. And those actions are within the profiles of individual, profiles of households. So the actions are in the profile. For example, if we open, this is Mary Wanjiru. This is a member of a household here called Mary Wanjiru, Peter said a household. She belongs there. So when I open the profile for Mary, two things I will be able to see. One, it will give me the sex of Mary and the age. And when I let me close the messaging is speaking. Yeah. Thank you. So if you open, you tap the profile for Mary, you're going to get the action button, and this Tabby talked about. And there are services assigned to Mary. These are the action. The action sits in the profile. For example, assessment, death report, defaulter, diabetes assessment, FP. There are several. Those are actions. They sit and wait for the CHP to act. And I will come to something called competencies. So different counties are at different levels when it comes to competencies. For example, the counties which have been trained on ICCM, there are others who are not. So depending on what a CHP wants to do, then they'll pick an action to undertake. So Tabby talked about those actions are based on age and also sex. So the actions which are assigned to a male are different from the actions which are assigned to a female. The actions which are assigned to under 5 is also different from an action which is assigned to over 5. For example, you look at what is assigned to Mary. Mary is a woman who is over 15, and there are several. And the one which I want to pick is mother and newborn PNC service. That workflow can only be assigned to a woman. Yes. Now, there are several, and I want to open for a child, another 5. Allow me to switch the Machakos. Yes, has to be. There's a household called Machakos Chaka. There is a child who is 6 years old. And if you come to those actions, again, we are unable to see the PNC, the pregnancies, they are not there. So the actions which are supposed to be conducted or done or taken by the CHPs are based on sex and age. Now, somebody would ask, how does a CHP select or offer a service? We are not changing anything. HS is not changing anything. The plan for the CHP to go and offer services in a household still remains. If they wanted to go and offer wash services, they will go. If they just wanted to go and kujulia hali, that is yes, the street word, kujulia hali, that will still be captured. And that is where I want to start from, because that is what is commonly done by the CHPs. And kujulia hali has been put in a word which to some people would mean a big thing. And kujulia hali is called the assessment. And when we talk about assessment, a lot of people would think about assessment is for people who are sick. And I want to say assessment is not for people who are sick. Assessment is for everybody. And allow me to look for somewhere where we have under 5, because you need to start with the children. A household with an under 5. Yes. Sydney Higen Kirwa is 3 years old. Maybe let me take Kipruto Arap Kirwa, who is 11 months old. So when you come to the profile of Kirwa, there is the action button. So me as a CHP, I've gone, and what I want to do ni kujulia mtoto hali. That is it. Because we are told that this is what we need to do. We target under 5 for immunization and all that. So I want to know more about Kirwa, or just to see how he's doing. So what are the actions assigned to him? Assessment, death report, default follow-up, diabetes, immunization, and mute. So when it comes to assessment, service, just allow me something else. Yes, I had to stop sharing. Allow me to share again. So when you go to Kirwa, there is the first question you'd want to ask. And that question would be, how is the child today? And that is the only thing I want to look at. Then we go to the next thing. So it was at, yes. Somebody confirm if you're able to see my screen.
We are able to see.
Okay, thank you. I lost the screen sometime. Yes, Kirwa. So the first thing is assessment, and then you click assessment. And let us be keen here, because this is all about a child, and the child services are embedded here heavily. The first question is Kiprito Arap Kirwa sick? And this is the only question I will talk about. Then the rest we'll do in another time. If you say yes, it means that this child is sick at that time. And assessment, which is going to be done here, will be presumed to be assessment of a sick child. So at the end of it, we are going to have the total number of sick children who are assessed. If you are to say no, then the assessment we are going to conduct here is what is called general assessment. General assessment. And so what is the target? In its own wisdom, MOH has targeted all children under 5 to be assessed in a month. Not because they are sick, but it's because we want to know everything about a child. In this assessment, we have immunization assessment, we have nutritional assessment, we have eye care, we have treatment, minor treatments. But if you say no, it means that this child is not sick. So we are going for nutrition assessment, immunization assessment, things like that. So at the end of this form, there are 3 things you're going to look at. At the end of the month, as a supervisor, how many children were assessed by a CHP? How many of them were sick? And how many of them were not sick? Those ones who were sick, if they were able to treat, how many were treated and how many were not treated? There are other bits like the ones who are malnourished. There are several. But in a nutshell, that is the segregation of data we'll expect from here. The other form or workflow, I'll exit this one, will be related to pregnancy. And pregnancy, we have two types of services. We have pregnancy screening and pregnancy follow-up form. Screening is where we screen to map the pregnant mothers, which is a very key and the entry to service delivery. So we need to map all women, screen all women of reproductive age if they are pregnant. So I would pick a woman here, and I will talk about Mary Wanjiru Mwangi. Hopefully she's a yes. Action button. If you scroll down, I don't know what's happening.
You closed it or let's go back to that. Let's go back to that tab.
Yes.
The tab, the CHIS tab.
Is it back?
Not yet.
Let me stop share, then I come back.
Yeah, and you may need to fasten a bit.
Yes. I'm rewinding. Yes. So yes, we are here with Mary. Yes, I got it. And Mary has got a number of services related to a woman. There is the PNC and there is the pregnancy home visit. So the pregnancy home visit will be used as a screening. And there is a difference. If you're meeting a mother for the first time, it will ask you a question like, is so-and-so pregnant? And if you say no, it will explore whether they've lost a pregnancy or whether they have been able to use an FP. So it will be used as an opening to address issues of FP and also issues of pregnancy, as well as any miscarriage and such things. Then I want to talk about frequency. The moment you submit that form, the first pregnancy form, the next form which will follow as a task. And that's why I talked about actions and tasks. So there will be a monthly task which will be reminding a CHP to go back and visit this mother until 36 weeks. At 36 weeks, the system detects that the mother could deliver anytime. So this form will give way to the PNC form, which is what I'm now highlighting here. The PNC form will come automatically as a task after 36 weeks. So, and it will come every week to allow us not to miss the PNC services within the first 1 week. So every week until this mother delivers. Then we have the FP forms. FP forms are action-based and are based on demand and several other forms. Let me come to the last thing because I will not be able to go to the CHA form. These services, they're quite a number, and titles in the subsequent will deal with each and every form based on the request by the officers. At the end of every service, we expect the officer or the supervisor to be able to monitor performance. And performance monitoring, there are several tools. You've been shown the dashboard, but I want us to look at the CHA phone or app, which are the functions which have been put here for us to monitor performance. So at any point you go to a CHP, the first thing you need is to pick the phone. And there are a few things I want to show you now. You will have the list of the households. And this is, if you can see my cursor, these are the list of the households. there is this sign, it's a danger sign, and a 0 visit. So for a household not visited within a month, you'll be able to see 0 household visit. So that is the first thing. You scroll the phone and you scroll the households and you see the number of households which have not been visited. You will see them, the one with 0 visit within the month will be on top. Then as you scroll down, you'll be able to see the ones who have benefited from 1 or 2 contacts by a CHP. I hope I'll be able to see 1 or 2. Yes. We have not been able to submit any form here, so we are unable to see. You'll be able to see 1, all the forms we were canceling, so we are unable to see 1. You'll be able to see visit 1 time, 2 times. So 1 is to engage the CHP on the number of households visited vis-a-vis the ones who have not been visited, and ask them why today is 28 and you've only done 3 out of 100. Yes. The next thing is on the households which already been visited within the month. You'll be able to open a household and check the kind of services which the CHP have been able to offer. And these services, again, these services will be able to be shown on the household profile. Within the last 3 months, you'll be able to see the services which have been offered by the CHP. Yes, and in a minute, I'll be able to show you in a minute. Yes. So if you come to a household, you'll be able to scroll down, you get the members, then beyond it, there'll be tasks and reports. So at the task and reports, you'll be able to see all the households which have had what is called a contact with the CHP within the last 3 months, and the services which have been offered, including the date stamp. So what you're able to do is to engage the CHP. For example, we were able to see a CHP goes to a household and only does wash services, and they go. And we want the service of a CHP to be as integrated as possible, so that when they go to one household, they're able to see a pregnant mother, talk to a youth about FP, then talk about wash, and then they can now leave. So with that alone, you're able to see the kind of work the CHP. That is before you go to the CHA app and the dashboards. So there is a lot of sufficient tools which have been provided within the CHP app that will enable us to monitor the way CHP is working. The last thing, before I yield back to Titus, is that there is need for us to do spot checks. And the spot checks is where every month we are able to select randomly households and work with the CHP and check, compare the kind of services they've offered vis-a-vis what is recorded within the system. Let us make sure that at all times CHPs are aware that we'll be coming to check what has already been reported. The beauty about this tool is that it has it has the memory that it will enable us to check what we've been able to do within a particular period of time. I think Titus, that is what I wanted to talk about briefly. I hope we'll be able to look at more workflows deeply in the next.
Yeah, thank you very much, Seda, for the good presentation. I know the system is still wide. We may not be able to cover everything today, but you comprehensively covered the different areas you were able to tackle. I would like to take this opportunity to welcome Philip Ngare from MEDIC, who will just give us an highlight of how best we can address the different issues the CHAs and the CHPs are actually facing during the implementation of of CHIS and service delivery at the community level. As you come in, Philip, there is a question which you might want to see how you can start in addressing it, and that is on synchronization. And one of the members just asked, for the past 3 months, I've been trying to synchronize, but I can't go through. And but previously it used to sync very well. And also another user was asking, yeah, I'm not part of the community members, but I'm part of the community, like I'm the malaria coordinator, and I also get an access to each system. Meanwhile, Seda, we can go through the questions in the Q&A section and let's try to respond to the questions. Thank you. Welcome, Philip.
Great. Please confirm that you can hear me, Titus.
It's loud and clear.
Great. So my name is Philip, as indicated. I have been supporting in the deployment of witches in Kenya, and I've worked with most of you in Kenya.
Titus, do you have something to add? I can see Philip is muted. Thank you.
Yes, Alois.
Philip, you're muted in case you're talking.
No, he was not.
And
he was not talking. I actually cut him short to just recognize the members who are following us in YouTube, Facebook, and Twitter. I think Philip, now you keep on your questions streaming.
Great. Confirm that I'm back again.
Yes, yes, Philip.
Great. Thanks, Titus. I've been reading some of the questions that have been coming on the Q&A, and I will start with questions around user management. My colleague Tabitha did manage to go through that process and indicating that before 2024, user management was being done centrally, but as we all know, there has been rapid scale up, and that actioned the team to sit back and see how to effectively address that question. The team went back to develop a tool that would support this function better. And this is where we developed a user management tool, as a tool that can be used by county staff to make sure that user management gets resolved. One, in the spirit of devolution, two, in the spirit of building capacity and sustainability within our counties. For most of the questions that I've seen there, it's still a clarity on the process that before and even now, it's a county-led process, and therefore the community health services coordinator would be the one to correct users from all the sub-counties, all from the users that require credentials. And we have provided templates that are used to collect that data. And when they approve at the county level for the users to be created, this is then transitioned to the county HRIOs and the county SCTOs who have been trained now. And they would go ahead and create the users in the system, share back the credentials to the focal person, will now initiate separation of those credentials to the respective counties or sub-counties where they need to go to. And that's how the process lands. We have seen so far that we have about over 109 county user managers who have been equipped with this skill and are currently supporting that role in the devolved units. In terms of the question around syncing, as one of my colleagues indicated at the beginning of this conversation, the government of Kenya did invest in ensuring that while this is acknowledged as a barrier, that is access to connectivity, and also for the community of promoters, the government invested in a service that would make sure that the link that the CHPs are using to do their service delivery via the eChiefs mobile application is what you can call zero-rated. So the government pays on behalf of the users. And we have been in the process of ensuring that all those CHPs that are enrolled continue accessing the service. And a lot has been happening. I want to acknowledge that from some of the investigations we have done, we still have CHPs who cannot access the service. In my own experiences, for example, in some of the counties that I've visited, we have managed to pick a few things. One, the ability for you to access a service because probably you have the user themselves have disabled mobile data on their phone. And one of our guidances has been that while the service has been zero rated, SHP needs to keep their mobile data on for them to be able to access the service. We still have counties where connectivity is still a challenge, and efforts now are ongoing via Safaricom to reach directly to some of these CHPs and be able to investigate their devices and their behavior while trying to access the service. This is something that we have done over the last couple of months. We do feel that we are covering enough ground by now, and hopefully we'll be able to see if it's a single issue across everyone, or it's something that needs to go beyond them not being able to sync. In some of the countries where we are, we know that connectivity is very spotty. You'll have it today, tomorrow you don't have it. And therefore, what some of the CHPs have been doing is they visited the nearest facilities where they are able to sync for the reports. The advantage we want to communicate here is that the mobile application they are using is what we call offline first. And that means that as HP, once they log in, can continue offering services for a couple of days and then be able to sync their app. And that makes sure that reports move up and they can be able to access any new updates that come to them, be it for new improvements on the workflows, if something has been fixed which was previously broken, or even be able now to get tasks that are coming out of their supervisors. So yes, the syncing issue is cutting across counties, but I can assure people that the government is doing enough to make sure that this will be addressed soon. We'll continue sampling CHPs from counties and getting to understand from their devices on how this has been. We've also communicated the same to the CHAS because one, we know they are the first line of support. And therefore, we have previously been able to talk to them and say, in case you get such an issue, the first thing that we normally ask for is the CHPs to share a screenshot via the chat on the About section of their mobile app, where we are able to see how far behind or when was the last time that they synced. And then from there, we are able to know, is it a connectivity issue or is it that the CHP actually has turned mobile data off on their phone? In some cases, we have gone ahead to probably ask a CHP to load some data bundles on their phone, enable mobile data, and you find that they are syncing. So for some of those cases, we've been able to sort out. And we hope that as we move forward, this service will definitely get better. I saw another question around when trainings happen, how do CHPs then get transitioned to start offering services in the households? During trainings, all with and across the tutors that we have used, we have always advocated that the trainers support the CHPs to uninstall the app that they use for training and install the app Rebot, which is 2.0. That app is available in the Play Store. I want to acknowledge counties that have probably generated a generic or a single Gmail account. And now that one allows the CHPs to be able to access the Play Store and be able to download this app. My guidance here would be that, for example, we know like one of our panelists here, Sandra, said that probably you would give households registration to be maybe a month or so. But for CHAS, and this being a very critical step in terms of service delivery, it will be important for the trust to track closely from the CHPs and know who has not been able to undertake an activity, and even go to an extent of during the activities that they meet with them, pick those devices, try and see what are they still using, and they will be able to probably arrest some of those issues as early as possible. It is a technical burden if you would try to think of how to move data from training to production, because as it is now, it's not something that the technical team has been able to jump into and give that support. Remember, you may do it today and then the CHP things again tomorrow, and that means that there is still data sitting there on their device, and that means that their activity or their performance in terms of the various service areas will always be left behind. So that's one of the key things that we have also tried to follow through whenever supporting CHPs. The other one has been around the devices themselves. Yes, we have gotten requests from people saying the devices they have issues with, let's say, the device is either shutting down whenever they put it on, or the device is overheating, or the device cannot open further than the login page. And one of the recommendations, which is very clear and has been communicated severally, and which we can continually enforcing, is that the government has also organized on how Safaricom gets to solve some of these issues. Remember, there is the documentation that is supposed to be provided from all counties on the devices that have been received. And that is, in one way, going to support the insurance of those funds, so that in case of loss, the CHPs through the county can be able to get police abstracts, and therefore those will be communicated forward, and that will be the start of the process of either replacement or recovering that fund is it restored and be tracked. So I think in terms of that case, one of the ways that is being recommended is that through the county, a compilation of all those funds and their emails is recorded and now taken to the nearest Safaricom care center or agent. And once that report gets there,
Philip,
yes, Titus.
Philip, are you able to hear me? Philip?
Yes, I can hear you, Titus. I can hear
Maybe
you.
you can move close to your microphone. You are a bit.
Titus, can you hear me?
Yes. Are you able
Right.
to share your video as you wind up, as well as move close to your microphone?
Yes, I'm sharing my video. I hope you can now see me.
Yes. You can continue as you wind up.
Yeah. Thanks, Titus. So just to say that then the Safaricom care centers and the Safaricom agents are the easiest places that these devices can be then taken through the support of the county committee of services department, and therefore the process of either repairing them or replacing starts there. So for probably in counties who have this, I think this is one of the processes. There is an email that has been provided by the Department of Digital Health to make sure that this process is smooth. In case there's still an issue, we will be able to provide contacts where this can be communicated either in an email, and then that support communication will be taken from there. Looking into the future, we definitely want to continue improving on the user management. We want to make it sure that all functions can be handled down there. For example, in one of the success cases, initially we used to spend like almost a week or two in creating a county. But with the onset of the new tool, we, like in Q1 of 2024, with the new tools, we were able to create over 30,000 CHPs in a county, and that has accelerated the uptake of it in Kenya. So there will be improvements coming along, both at the user management tool, both at the workspace, and even we are looking at some innovative ways of making sure that any changes get the CHPs and their supervisors in a uniformed way. And therefore, we'll be testing out some things like the training cards. There will be pop-ups that come to the CHP whenever they get access to connectivity. And then they'll be very specific on the changes that have been done to workflows, or even for new workflows. That's now removing the burden of the high cost of trainings CHPs in the normal classroom model, but making it possible for them to access at their own time. I hope to have covered all the questions on support. You definitely will see or will continue hearing of what the roadmap for the next 3 years look like in terms of the new workflows to come, enhancements that improve the user experience, enhancements that make the infrastructure more stable to make sure that there is seamless access and availability of the systems. And I believe we'll have more opportunities to continue interacting just to make sure that everyone feels they are supported as they deliver care, and even the supervisors get the access they need. Just to mention the last one, which I saw in the Q&A about the access of the CHAS to the dashboards. Through the county focal persons, we are already finalizing on a feature that will allow the CHAS to have SIGO login to view all the CUs that they manage, and also access for them to superset, where they'll be able to see more of the supervision data than they can see in the ETs app. So maybe from September, you can expect more updates that will make the work easier. And we definitely will also be having more features that help you to give us feedback on some of the areas that you want to be strengthened. Any features that you have idea of that you feel we can test and will make your work better, as well as general feedback on support areas. So I want to leave it there. Probably if Titus, there is another question, please let me know. Otherwise, I thank everyone for coming through and asking questions on how better we can support you. Over.
Thank you very much, Philip. Maybe you can just respond on this last one. They're asking whether the CHAS phones can also be whitelisted. Maybe you can just clarify on that. And as you clarify on that, Tabitha, Beth, and Seda, you can, I'll give you 5 minutes session to just respond to some of the questions. I know we have around 130 questions, but we might not be able to comprehensively answer all of them. But let's pick the key ones. Philip?
Yeah, so I'll defer that question to Dr. Maureen. I know as a division, they are working towards thinking how that can be done, because it's something that has been raised by the CHAS. I think one of the other comments I could make before I usher in Dr. Maureen is the question around the requirement for IDs for registration of households. Yes, from the user feedbacks that we've done in counties like Isiolo, Makueni, Kakamega, and others, this has been a pain and that's impacting household registration. But there is new guidance that we should leave this to be optional, including other fields in the household, the new person registration form. And therefore, we hope that by September, these changes will come through, and therefore, these details will not be a requirement. That's enabled unbroken CHPs to be able to continue with their services. So that's just one of the improvements that is coming up. And we will definitely be sharing updates on what those changes look like. Back to you, Titus.
Thank you very much, Philip. I would like to welcome first Tabitha to just respond to the few questions. But what I wanted her to ensure that she answers is the aspect of some community members do not have IDs for registration. So what can we do about that? And then there was an aspect of network, which you've already answered that very well, Philip. So Tabitha.
Thank you. Yeah, I want to answer the question on members who lack ID numbers or any form of identification. So currently, the only required field is when you're adding a household head. If it's not a household head, you can be able to say none, like they do not have that identification, any form of identification, and it allows you to move.
We've lost you, Gabby.
So in an event, the household head does not have the identification document. Now that is where we come to the program part, because that is not ECHIS. First of all, I want to say why it is really important to have the identification. Ministry of Health, through the digital health division, they are establishing a client registry, and this is whereby all records of clients will be stored in an event that it will be able to, the clients will be able to be managed more efficiently. You will not be required to be carrying your medical records. When you put in your UPI is the unique person identifier, all your documents will be availed to the clinician or to the health worker that is seeing you. So that's why we want the person, the ID, because that forms a single source of truth in regard to the information for individual clients. So this ID will help in generating the unique patient identifier, and you can move with that unique patient identifier across all levels of care. So that's why it is important to encourage our people to get ID, so that when we were doing the registration for the household, we assume that in every household, the household head will not miss any form of identification. But where they do not have, we can use another one. We can devise ways. As I'm saying, this now comes to the program. It's not ECHIS on how do we best register these households, offer services, but most importantly, advise them to get an identification. But the other people, it's not a mandatory field. You can be able to say no, you advise them to get, and you proceed on to give other services. Allow me to answer a question that I had seen in the comment area of having 10, 515 for different CHPs. The CHA comes as an aggregated, because 515 is not a tool for CHP, it's a CHA tool. It's a CU tool. And that means that it is just for 515, an aggregate of your 10 or whatever number of CHPs that you have, but it is an aggregate of the CHU, not the, I don't know, the one that had asked that question, where you get the 10 from, but it is one. Maybe it's because you have maybe 10 CUs that you're manning. It's so unfortunate that you're going to get 10 and approve each for different CUs. But for one CU, it's only one 515. Another one I had seen, so where there's a CHP report when they do any service outside their area. And my answer is simple. We are not supposed to do any service outside our area. And if it's a must we do, or we are compelled by some circumstances that we have to do, then we need to register those households so that we can be able to offer service, because we're offering service and every Kenyan has a right to health. So if in an event that we want to offer outside, which we should not, but I know there are those unique cases, then we should start by registering those households as our members of the area. Thank you, and over.
Thank you very much, Tabitha, for the comprehensive response. I would like to welcome Seda. And Seda, I wanted you to maybe clarify the following. Some of our YouTube members have asked some questions, which include one, date reporting. They are saying that when the CHP forwards a date report, the chair is not able to see at his or her own end. And then can the 515 be updated as early as the beginning of the month? And then regarding the 515, then they're asking again, how can one view the 515s for the previous months? And then the aspect on the CHPs who've actually swapped communities, how can we address that? And I know as well, Philip can as well say something about if a CHA has moved from one point to another, or if a CHP has moved from one point to another, what actually happens for us to be able to ensure that we actually address those issues of swapping the community level. Welcome, Aseda.
Thank you, Titus. And I want to answer the first question, but the question on automation happening, I know not all counties have been able to automate, and every instance for the county has a timeline when they're supposed to get their triggers. So I would leave that to Tabitha to talk about. I want to talk about the issue of death report. And if you allow me just a minute also, there's somebody who has asked how to edit a form which already been submitted. And I want to start by the death report. For a child to see a death report for a child will come as a task. So it means that when there's a death in a household, and the CHP will actually report two kinds of death. The death happening at household, at home, and the death happening in hospital. The death happening in hospital, we will be able to report it for the purposes of cleaning our role, like we remove that person from HCs. So a CHP need to report that. But the death happening at home, one, we need actions to follow, like verbal autopsy. So whenever there's a death report reported by CHP, within 24 hours, the child is able to act on it. One, we need to have, CHP need to sync. So a successful sync means that the CHP shall have communicated to the server. Then the child also need to sync on the other end so that they get the trigger, because it comes, they get the task. It comes as a task. So if one of them fail to sync, or the sync status is not up to date, then that report will not be able to be seen by the CHA. So the CHA, when a CHP who is reporting death, must sync immediately, successfully. Then a CHA must also sync to get the report. And we request that we need this to go so that CHP do not keep on meeting the names of people already dead. So CHAs need to act frequently, adequately and fast. If you allow me, on the issue, somebody was asked about how to edit reports which are already gone, forms which already been filled, but a CHP might have made a mistake. I want to say that this is happening from a source, meaning the CHP who offered the service and made a mistake is the one who's supposed to do this edit. So it happens in the CHP's app or phone. So what to do, and allow me just for a minute just to share, is that, are you able to see?
Yes, come.
Not yet. Yes. I want to look.
It's, the system is telling us that your network bandwidth is low. So let's see whether we can see.
I lost network at some point. Are you able to hear me?
Yes, we are able to hear you, but we do not see the screen. Your screen.
The screen is up.
Yes. You can see
Yes.
the screen now.
So,
continue.
Yes. We need to, whenever there's a CHP need to be helped, and if they are able to master this, is the simplest. So there is this tab called reports. So for any form which is filled incorrectly, a CHP will be able to come to the report section. And in that report section, you can either filter, and the filter is on the far right, the top right. You can filter by form type, place, so that you find the specific form or workflow which had a problem, a form which was filled incorrectly. For example, I would pick this one, Aisha. I don't want to filter. So Aisha, the CHP might have made a mistake with Aisha because pregnancy screening. So what you do when the form has appeared, let me close the filter. You don't click the box. You click the form itself. So I'll do a click if you're able to see my screen, and it will give you this kind of a picture. Is more of the tech language. At the top right, there are 3 buttons. I don't know whether you're able to see. There are these 3 buttons. You'll click, and there is edit.
Yes, we can see.
When you edit, it gives you the view of that form as was selected by the CHP. So that you see, for example, is Aisha pregnant? The CHP picks don't know. When was Aisha last monthly period? And you're able to change this to say yes. If you go back to don't know, it gives you everything. So you'll be able to change, and at the end of it, you submit. So that you make that change, then you submit. I want to say this. Any corrections which are made after the monthly reports have been submitted, we might be able to change them within the system, but within KHIS or reports which have been submitted, we might not be able to catch up. So any change which is that we do it within the month. Thank you.
Thank you very much, Seda, for clarifying that. I know team members, our time is over now. I would like to request the panelists, led by Dr. Maureen, and all the panels, if there is a question, we have quite a number of questions which we are going to see how we can consolidate all of them and respond as we continue having our webinars. But allow me to give the panelists 5 minutes, each 1 minute for each one of us to just say something, and if there is a question we would wanted to respond from the questions, you can take that opportunity. We just take 5 minutes to respond on that so that we go towards closing.
Titus, I go on first?
Yes.
Yes, thank you so much for organizing this. And my parting shot to colleagues is that for the successful implementation of this program, we need a child who is over-empowered. So I want all of us and the supervisors to take our place and make sure that we are the source of reference for the CHPs. So in our own time, there is a training instance. Let us interact with the system, ask more questions. Our numbers will be out there. There are people you can contact. Let us be more empowered. And again, let us have more knowledge on this, not only on the workflows, but also on the modules so that we adequately support the CHPs. Thank you.
Philip, can you go next?
Right. Thanks, Titus, and I hope you can hear me.
We can hear you.
Right, thanks. I've tried to answer some of the questions that are a bit technical in the Q&A. The question on cases where chairs have multiple logins for the various CUs that they manage. Yes, we acknowledge that that's an experience that they have consistently communicated back to us, and we have developed a solution for that. So we are hoping that in the next few weeks, maybe by mid-September, after we do the upgrade to all the systems, CHARS will get one credential that they can log in to be able to view all the CUs under them, just like the way a CHP login, you can see all the households under them. And for more analytics, it will not be possible to, again, use the Superset dashboards to be able to see more advanced analytics coming from all the CUs that they manage. For connectivity, I do agree. There are some counties that we border. So you find like counties like West Pokot and others that border, let's say, MTN Uganda. And therefore, that might automatically mean that even if the services were twisted, there is a challenge around that. We will continue advocating to Safaricom. They have committed to continuously monitor the network boosters around the country, and probably even being able to see how they can work with the government to strengthen connectivity in those counties. For credentials, I've just mentioned in the channel that for us, we know that even the CHPs and CHARS, all of us have been sensitized on the requirements of the Data Protection Act. Credentials should not be shared. Ideally, whether someone has left service or it is support, in cases where either someone has swapped areas or have left service, the request should be to the focal person during the CHAR to make sure that a new credential is generated and the outgoing one replaced, so that one, we can keep accountability of who provided service where and about what credentials. So we really encourage the supervisors to make sure that credentials are not shared. For cases where credentials are not working, please note that you have two user managers in the council who are supporting this role, and we have monthly meetings with them just to make sure we are getting to learn some of the user manager issues they're having in the county, and we are helping them resolve some of those. So in case you still have those questions, kindly get in touch with your sub-county focal persons who will link up with the county ICTUs and HRIOs, and this should get sorted. As nowadays it's very easy to get those. It shouldn't take time. For some of the other questions that I've seen, probably around maybe remapping of households. I think that's a sub-policy related question. But I think for support, I would say that we continue to monitor how people are using the systems. We are opening to hear more on your experiences as you continue to deliver services. And very soon, just to mention that there'll be a call center coming up where CHPs will be able to call in and raise issues that they're experiencing directly to a team at help desk, and they'll be able to tackle those that they can, and at the same time escalate the others to the people who will be managing, who will be across the various work streams, whether service delivery, technology, devices, etc. And we hope that this will ease the experience and make sure that everybody has a better experience as they continue delivering services. Otherwise, thanks everyone for your questions. We hope that we get to connect more on this. If we get opportunities to come to those areas where you work on the ground, we've been to some of those, we'll definitely come. And we believe that the transformation journey has just started. There is more to learn, and definitely we learn together. At the end of the day, it's the Wajiko down there, and we believe that together we will make it happen. Asante.
Thank you very much, Philip. I know there is a question which has been asked whether an household can be deleted in the system. As Tabitha comes in, I think you can handle that, or if you are comfortable with that, Philip. Tabitha, you'll be next.
Yeah, the question on deletion of households is dependent on probably either it's in the wrong area. Should that be the case, then it's possible to do that. As probably someone erroneously, as they started to orient themselves on the app, found that they did this differently. We definitely want to continue exploring other technology opportunities that may help us move those houses to the rightful place, so that then one doesn't have to do the action afresh. Over. I saw a question at Titus on 515. I know this is an effort that has just kicked off in July, piloted at the national level. So some more work is going in to make sure that it's holistic and it's offering the service that is required to do. So we believe that going forward in the coming months, there'll be a lot of interaction on how 515 tasks will be coming to just for verification and eventually getting pushed to KHIS. I think in the spirit of Smart PCN, even referrals from community to facility and back is also something that will also be entrenched in the Smart PCN as they get set up. And we believe that will also provide opportunities to be able to answer some of the questions on how are we able to track referrals and all that. So much more coming, and we do hope that as we continue to interact, we'll be able to communicate as and when this gets set up.
Thank you very much, Philip, for your comments. Tabitha, last few words.
Yeah, thank you very much. And my parting shot would be to add a little bit on the question of deleting. I think initially we had not seen some of the scenarios that would warrant to delete, because we believed that before you register, you should be, a CHP should be very sure that these are the members of the household, this household is within my area. But I came across a scenario whereby a CHP had registered someone in that household, and even after introduction and everything, explaining the purpose of visit, they said yes, they belong to that household and they are the spouse to that household, and so they registered them. And then another day, as they were going to their other household, they met this same person in another household. And then now when they were registered, they remembered they had registered them somewhere else. So he told them, this person told them, no, remove me from the other household. Now I am in this household. So yes, we have such scenarios. And what I want to echo, to reiterate, is that we should be able to communicate so that they are moved. Let not CHPs mute and then start afresh in this other household, because that brings about a mixed match in the denominator. The other key area that I want to speak on, I have seen it over and over, is on the MOH 515. As I said, it is only 1 for 1 CU. There's someone that had asked, where do I generate that from? This is from the Superset dashboard. You go in the supervisor dashboard, and to the far right end, you will see the aggregate MOH 515. You will be able to download that. You can also go to the KHIS and be able to download your MOH 515. Another one is around data demand and use. We should be able to make use of the performance tab and the superset so that we are able to digest our data and be able to use it for decision making. I think that's all from my end. Thank you, and over.
Peter, you're muted.
Sorry, I'm talking on mute. I was saying Alois, Dr. Maureen, any comments? I'm also seeing Linda.
Thank you so much. We have Dr. Maureen and myself. Mine is just to appreciate all the hosts, all the panelists, and even the CHESOA for helping us to all this, the Ministry of Health for supporting us as an organization to reach out to all the community promoters and community assistants in the country. I've seen questions around payment of the training money for those people we have trained on basic modules. I think that is also being resolved, and we want to handle that. So just as a parting shot is to continue encouraging you, continue giving you the hope that this is the system that will transform the country. And when you look at what is available now, it will be able to transform the way you offer services to the populations through what we call precision public health, because you'll be able to track the health status of households and the status of individuals throughout the country. So mine is just to tell you to keep up the good work, and let's again meet next week for the next webinar, because we wanted to organize a webinar series. We want to communicate the topic as early as possible, And we'll also keep you updated on YouTube, because the link to this meeting was shared on YouTube. So those updates that you have seen on YouTube will keep up coming up, and also on our other Twitter handles. For the question and answer that have not been handled on this session, please be on the lookout on CHU for UHC and amref.org pages. We want to respond to some of those questions with the answers from the experts that were in the room and that are not in this room today. Thank you, and over to you, Chair.
Thank you very much, Alois, for the parting shots and also the clarifications on the next steps. Dr. Maureen, the parting shot.
Thank you very much, everyone, for staying till the end. I see we still have almost 400 people who are still on the webinar. So really appreciate your presence. I've seen the very many questions around whitelisting, and just to say that we are working very closely with Safaricom just to understand why some CHPs are able to sync and others are not completely able to sync without using their own data, because this is a service that we already have an agreement with Safaricom to support. So that is an ongoing discussion, and we will be informing you through your focal persons at the county and sub-county on the way forward on that discussion. Also to say that we have upcoming webinars, so we hope that you can still join, because this is an ongoing education session, and all we want to do is ensure all our chairs are able to manage and support CHPs using this system that is helping us to get quality data, which will help us inform our prevention agenda and also support the services at the higher levels. I think that's it from me, just to thank you, and please share the information with those who are not able to attend. And also they can, we will share the link widely, so that the YouTube link, so that anyone who wasn't here can be able to watch it. Thank you, and have a good evening. Bye.
Thank you very much, Dr. Maureen, for the parting shots. We are moving to the tail end of this session. I would like to welcome John Onyungu, who will be offering closing remarks for the session. John?
Thank you, our lead moderator, Titus. And I want to take the opportunity to thank our very able speakers who have shed light to a number of issues that have been disturbing our chairs countrywide. I'm happy that today we have had many issues clarified. It's a starting point, and we hope to do this more oftenly, weekly if possible. I also want to thank AMREF for facilitating this session using their infrastructure. And so to all those who have been able to join this session, especially from the counties, thank you very much. From our partners who were able to attend, thank you very much. I know many questions were not answered. There were over 100 questions, so obviously we would have clarified all of them, but quite a number were clarified. Maybe we'll have a way of responding to the questions, probably posting them. Maybe AMREF can also provide a platform where we can have Q&A session shared with the counties, especially responding to the questions that have been raised today. So I don't want to take so much of your time. I don't want to keep you in the meeting any longer, but it has taken us over 2 hours in this meeting. So I would just wish to thank you once again and wish you a good evening. Continue reflecting on today's discussions until we meet again next week. Thank you, and the meeting is therefore adjourned. Asante sana.
Thank you very much, John.
Thank you,
and
John.
thank you very much, participants, for participating in this session. You requesting us, the meeting has been adjourned. We can leave at our own leisure. In our next meetings, we'll be giving slot and